Okay, for the last video on the arteries, we're going to look at branches coming off the abdominal aorta and then going out into the leg and the foot. All right, so this is figure 18.8 in your lab manual. Again, orient yourself. So here we've learned the thoracic arteries already. So there's that diaphragm where we left off earlier when we were talking about the thoracic aorta or the descending thoracic aorta. So now we're going to take a look at once you go through the diaphragm, what's going on inside the abdominal cavity. Your aorta is going to keep extending. It's a very large, that's this really large blood vessel that goes all the way down the middle of your abdominal cavity. So all throughout here is aorta. This is your abdominal aorta. And then you're going to have lots of blood vessels branching off of that. And you can see all these little squiggly red lines. So the first branch coming off the abdominal aorta is the celiac trunk. So that is just this little tiny branch of an artery, and it goes from about there to about right there. So that right there is the celiac trunk. Coming off of that, you have 3 branches as well. So it just extends. One of those is called the left gastric artery. That's coming over here. So from there to there. And that's going to be going to your stomach. You also have the splenic artery. You only have one spleen. So this is, and you only have one stomach too, but your splenic artery is going to be going over on this side of your body as well, and that's going to your spleen. So stomach is where the gastric is going, and the spleen is where the splenic is going. They did not show the stomach and the spleen in this view. They've removed most of the abdominal organs so that you can see the arteries better. And over on the other side of the model, you will see another branch coming off that celiac trunk. And it would, if the organs were intact here, it would be going to the liver. So those are the 3 branches that we see coming off that celiac trunk. And again, celiac trunk is the very first branch once you come through the diaphragm, first branch coming off of the abdominal aorta. Second branch directly coming off of the abdominal aorta is this here. And it comes off the front or the anterior side. And that's going to be your superior mesenteric artery. This is going to go to a lot of your digestive organs, your intestines, and again, in those mesenteries that I mentioned earlier, where blood vessels and nerves travel from intestines and things like that. So that's going to be the second big branch coming off the abdominal aorta, and it is on the anterior surface. Right below that, and you'll have 2 of these, one on either side, you've got your renal artery. Renal means kidney. So you will have a right and a left renal artery coming off both sides of your abdominal aorta. And that's right around the same region as that superior mesenteric artery. And then below that, you have 2 of these as well. This one and this one. These are the gonadal arteries. And depending on which chromosomal gender someone is, you will either have testes or ovaries. And so a more specific term would be the testicular artery or ovarian artery. But in most of the models, some models have different reproductive organs that you can replace and move around, and some of them are just asexual and they don't have any particular reproductive organs. So gonadal is fine. And when we learn the reproductive system at the very end, then we can come back and say, oh, this is a female, so that would be an ovarian artery. So this is going to the gonad, whatever the gonad is, and one on either side. Then you have another branch coming off the middle, so on the anterior surface of that abdominal aorta. And this is the other mesenteric artery, but it's just the inferior mesenteric artery because it's going to be below. And again, that goes to the mesenteries. And then at the bottom here, you have this branch here and this branch here. So where your abdominal aorta splits into two branches down at the very, very inferior segment, that's called your common iliac artery. And so you have a left and a right there as well. Looking at that 3 or 4 foot board model, zoomed in here at that same region. Let's start up at the top. Let's see. So right there is your celiac trunk. Really hard to differentiate on this model. So I'll show you a different model that shows this a little bit better. This is your liver on your right hand side of your body. So this is your hepatic artery. And then this is your spleen on the left-hand side of your body. So that's your splenic artery. And then they don't show your stomach. Your stomach would sit anterior to the spleen, kind of in this whole big area here. So this is going to be that left gastric artery going to the stomach that's not pictured in this plane or section. Let's see. So then we have superior mesenteric artery, just as kind of a chopped off artery there. You don't see the whole thing. And then moving down, you've got your left and right renal arteries. So these are kidneys. And there's another kidney over here. And then inferior mesenteric there, coming off that more inferior end or distal end of the abdominal aorta. So what they didn't label in this picture is that all of this, the big tube, is your abdominal aorta. And then when the abdominal aorta splits on the inside of your abdominopelvic cavity, this right here, till you get to there. So from there to there, that is your common iliac artery. And just to preview, so you do have a left and a right, and to preview what you're going to see in the next picture in your book, that's then going to split, and you'll have an internal iliac artery that's diving internally, and then continuing out here, you have your external iliac artery. So where that split is, that's where you have your internal iliac artery and your external iliac artery. And then this is your hip, your coxal bone. So once you come through, you've got this thing called a ligament, inguinal ligament here. That external iliac artery will have a new name once it goes into the leg. All right, this is a model of the urinary system that we have, and it is excellent for looking at those same blood vessels because it's bigger and you can see more detail. This isn't the best picture, but the best I could find with all the labels on it for you. So again, here's the celiac trunk. That's a typo. That should say trunk. Celiac trunk, it doesn't show all the branches, but there is your spleen, and they don't show the liver up here or the stomach up here. So you don't see those branches in this model. Superior mesenteric artery, renal artery on both sides, inferior mesenteric artery, gonadal artery, and it's going to come be part of this network down there. And here's the other one. So it's going to twist with this vein that we'll learn later. And that's a good clue that you're looking at the right thing when you're looking for the gonadal artery. And then, let's see, inferior mesenteric. All right, so then again, all of this is abdominal aorta with all those branches coming off. And then common iliac artery here and here. And then there you see diving down internally is your internal iliac, and then out here is your external iliac artery. And then this is what I was saying. You're going to go through a ligament on either side near where your pelvic region is. And once you go through that ligament, that external iliac artery is going to be in your leg. And so that's where we're going to see the femoral artery. So pause and practice with some of those models before you move on. Here's another model. This model has a much better detailed view of the celiac trunk and its branches. So let me introduce you to this. This is your spleen, not a kidney. So this is the spleen. This is the other side of this model. This is an anterior view, and this is a posterior view. Let's see. And the reason you know that is because your spleen is always on the left-hand side of your body. So when you see it and it's on the left, you're looking at it from the front or anterior side. This over here is part of your small intestine called the duodenum. And this in the middle is your pancreas. So that's the organs that you're looking at here. So from the back or posterior side, that's your spleen. All this pink glandular organ is your pancreas. And then this pink tube is your duodenum, which is part of the small intestine. Don't need to know those names yet, but you will learn them when we get to the digestive system. What we're looking at here as far as blood vessels is looking at the posterior side of this model. So on this section down here at the bottom, let's see if I can draw this in red. No, can't change pens. Your aorta would be back here like this. And then these organs would be sitting in front of it in a more anterior surface. So when you're looking at it from the back, you have to imagine that your aorta is here. And this is your celiac trunk. And then you have these branches coming off of it. So up top is going to be your left gastric artery. And then going over to the spleen is the splenic artery. And going over to the liver is going to be your hepatic artery. You also see your superior mesenteric artery poking through there. So it would also be coming off of your aorta like this. And then that's diving through your pancreas and your intestines to go give some nutrients to some of your intestinal organs. Looking at it from an anterior view, you don't see the celiac trunk in this view because it's in the back behind all of this. But across the top of the model here, you see the left gastric artery. Over here, that right there is your hepatic artery. So your liver would sit over here above your small intestine curve, that duodenum. And then if you looked at the top of this model, you could see it a little more clearly, but there's a red line running across the top coming over here like this. That's your splenic artery. So there are pictures of this model on D2L, or sorry, on Quizlet. And then what we saw down here as the very beginning of the superior mesenteric artery, you can see it on the flip side, the anterior side of this model as well, and it's right there. So that would be if you just turn the model around and look at where it's punched through underneath your pancreas is right there. And then you can see it on the other side. So then that's going to diverge and go to lots of your intestines. Looking at the torso model that we have, that's like the half body, you can see the same thing. So there's pictures there that I pulled off of this website down here, if you want to kind of take a look at those as well. All right, looking at another model. This is one of the models that we'll use for our urinary system. This is your abdominal aorta that you're seeing here, and the diaphragm would be right there. Technically, it would be right about there, so shift that down. And then first branch coming off the abdominal aorta is the celiac trunk. You don't see the left gastric, hepatic, or splenic arteries because it's not that detailed. And then the second is your superior mesenteric artery. Then you have your renal arteries, and you don't see the other one. It's behind that vein. And then you have down here that inferior mesenteric artery, and then your two common iliac arteries. All right, on to the leg. We'll go ahead and finish up the arteries in this same video. So looking at your leg, we have gone through that inguinal ligament, and we're going to have the common iliac artery and the external iliac artery while we're still inside the pelvic cavity. And then here is once we've gone through the inguinal ligament and now we're in the leg, we're going to have the internal iliac. Sorry, that internal iliac is on the inside as well. Sorry, all three of these are going to be inside that pelvic cavity. Then moving through the inguinal ligament into the leg, we will have the femoral artery. If you look at the branches coming off of that, your lab manual didn't label them, but this and this, that's your deep femoral artery, just going deeper to the middle part of your leg. And then looping around the neck of the femur here, and you see it over here as well, that's your lateral circumflex artery. And don't know why that's not letting me change my pen. Sorry, that's a little hard to see. So femoral artery going down the legs. And then if you look at this right-hand side of your picture is a posterior view, and the left is the anterior view. Looking at the posterior view, you can see this the best. That segment right there is the popliteal artery, and that goes, if you remember these condyles that are on the femur, the medial and lateral condyle, it runs in between the space in between those two, and that's going to be on the posterior side of your knee. Then into your calf, you have an anterior tibial artery and a posterior tibial artery. And then in the foot, you need to know the dorsal pedal artery, or some books call it a dorsalis pedis artery. And looking at the models here, this is a leg model that we have. So you can see the hip up at the top. So your common iliac goes from there to there. And then interior iliac diving down deep. And then the external iliac out here. And then once you go through that ligament that I keep talking about, you're no longer in the pelvis, you're no longer in the hip area, you're going to go into the leg. And you see that ligament over here. inguinal ligament. Don't need to know its name. You just need to have it as a reference point. So internally, you had that external iliac artery. And now that you've gone through that inguinal ligament, here we're going to have the beginning of the femoral artery. Let's see. And then that will continue right about here is where the deep femoral artery comes off. And it's going to go down underneath this, I believe, is vastus intermedius. You've removed rectus femoris, if y'all remember that muscle. And then your lateral circumflex femoral artery branches off right about here. So you have to remove some muscle, that very superficial medial anterior muscle. So on the front of your leg, y'all should remember, hopefully, that there's a muscle going straight up and down in your thigh, and that's rectus femoris. And that's the muscle that's been removed here, so that you can see that deep femoral artery and the lateral circumflex femoral artery. All right, and then looking at the lower part of the leg, you see your anterior tibial artery. That's the tibia, is that white bone, and you see it over here as well. So running along the anterior side. And, you also see that dorsal pedis artery, or dorsalis pedis, or dorsal pedal, whatever. There's lots of different names for that, coming across the top of your foot. And you can see all of this in this book, this model as well. Trying to move this up for you. There we go. It's as good as I can get it. Let's see. So up here would be external iliac artery. And there's a note in blue over here. It becomes the femoral artery once you've gone through that inguinal ligament. So now we're femoral artery. Lateral circumflex, and it goes up and around, actually. Not that. It goes up and around that neck of the femur that you're seeing there. And let's see. So femoral artery continuing here. And then the one that's going to be more medial or deeper is your deep femoral artery. Femoral artery continues down the leg. Don't need to know its name here. And if you notice, here's your patella. So your leg is turned in this side of the model. So now we're looking at the back of the knee, and that's your popliteal artery. And then it's going to split going into the calf and wrap around to the front of your tibia. That's your anterior tibial artery. And part of it stays on the back of your leg. That's the posterior tibial artery. And then into the foot. There you go, right there on the top of your foot, dorsalis pedis artery, or dorsal pedal artery. And you see some of those over in this leg as well. So I will let you follow the labels and practice with that. Here is the pelvis or urinary model, just a little bit better view. Celiac trunk, superior mesenteric artery, renal artery, abdominal aorta, inferior mesenteric artery, gonadal artery, and then common iliac arteries. And then there's your internal iliac artery. Don't really see it here, but it would be right about there. And then external iliac arteries. And here's the ligament. So once you pass through the ligament, that right there is your femoral artery. All right, that's it for the first half of the blood vessel lab. We'll do the veins in another half of the lab.